Small and rural practices often struggle with technology because of cost and complexity. What can be done to make sure they aren't left behind with telehealth and some of these other advances?
Well, one of the big issues here, especially in rural areas, is internet connectivity. Fortunately, state and larger organizations are working to improve broadband access, cell phone coverage in many of these areas, because that really is imperative if you're going to be able to deliver care in this way. But I will tell you, in the states that we serve with Remedy, we see lots of patients in the rural areas. Patients who might be a decent drive from a brick and mortar facility, but they're able to get connected to care using virtual care. So, I think as we look at rural practices where their patients may be fairly spread out, it may be more difficult for them to get in. Maybe they have transportation issues. This is a huge opportunity to really transform care for those areas as well. And again, some of it comes back to the reimbursement issue as well. I mean, these local and or smaller practices in these rural areas are relying on fee for service income a lot of times from these office visits. And so, we can improve connectivity. We can talk about more connected care and all these things. But at the end of the day, we have to figure out a way to reimburse these providers for that type of care in order to incentivize it and make sure that it does indeed take off.